Talk. A good friend and happens to be my wonderful neighbor. He's an assistant professor of medicine, as well as the rising star of hematology in our CLL group. Has published extensively on this subject, has been my go-to hematologist. He certainly can't escape me ever because of being a neighbor. So welcome Dr. Samir Parikh, please. Of course, I should tell you he's going to be talking about hematology consults since he's a hematologist.
Thanks, Hassan. Good morning, everybody. I'd like to thank the organizers again for giving me this opportunity to present to you this morning. It's bright and early, and I see so many eager faces. I think 20 minutes is about the only time that I can listen to any conference for the entire day, so I'm so happy that I'm going first today. So these are my disclosures. I am a malignant hematologist, or that's what my wife calls me. Essentially, I take care of patients with malignant hematologic malignancies, essentially. And these are my research disclosures. So I have research funding and advisory board participation with several companies, but these are all money that is given to Mayo. I don't benefit personally from any of this, and none of this is relevant to my presentation today. So just to establish the ground rules, it is important to start with normal stuff, so you know what's abnormal. And these levels are probably pretty similar to wherever you practice, maybe a few decimal points here or there, but I think it's important to know what these are so you can get started. Recently, Mayo had a change, so now our platelet count, the lower limit of normal is 135, but that's just the way it goes. So, when I started residency, somebody told me, if you want to get a nephrology consult, at least get a urine analysis. If you want to get a cardiology consult, at least get an EKG. So the same goes with hematology. If you want to get a hematology consult, please get a peripheral smear. You will probably never go see the peripheral smear yourself in the lab, but at least get one so somebody would have paid attention to what they're looking at. And this is what they will see. This is at a very low power. You see a bunch of red-looking cells, a bunch of white-looking cells, and then there are some places in between that really you can't see what's going on. So this is a 10x magnification where you now see the red cells that look like this over here. These are two neutrophils. And then when you go even at higher power, you're actually able to appreciate what a normal peripheral smear looks like. And you can see the nice biconcave red cells with central pallor. You can see the white cells. This is a lymphocyte. This is a monocyte. And you see these elements over here. These are all platelets. And so this is what a normal peripheral smear looks like.